Okay, so Dr. Kobe, take me through the journey. Let's take a cardiovascular patient. Let's sort of simplify it a little bit. Someone with like angina or just, heart condition, traditional model, what would happen? What would be the average cost? And then the future of health, which is what I think Medici is doing, preventative, making the service quicker, getting the cardiologist there, seeing if they need to do whatever they need to do, testing and echoes and EKGs, or whatever it is. But just take me quickly through the journey so people have got an idea of saying, hang on, this is the future of health because of the costs and obviously the complexity of doing it the traditional way.
Yeah. So the traditional way is the patient often will present with chest pain, right? The patient goes to an ER, gets admitted to OBS, gets a stress EKG, watch for a day or two while they watch levels fall, make sure they're not acutely decompensating, and you got a $20,000 to $50,000 bill, right? That's the average way a patient with cardiac disease is going to present in the fee-for-service system. In our system, we want to early on screen, so we incorporate into a tool we call Health Score. I don't know if you've heard about our Health Score, but this is a near-infrared camera that looks at your face and actually gets accurate vital signs, as well as unloads some questions that are really at getting your cardiovascular risk assessment done. So we know your risk for a cardiac event in the next 10 years based on Framingham scores and things like that. And that becomes part of our onboarding into primary care, is we will talk to you about, hey, you have a 12% chance for an MI in the next 12 years. I do? I had no idea. Yeah, let's talk about what you can do now and what Medici likes to do to help you avoid that. And let's see if we can get that number down. And so that proactive, and it's not that we're using fear, but we're using reality with our patients as a motivator. And then once people have a little sense of just the knowledge of, oh, I am at risk, I am unhealthy, that introduces them into our programs. And so we will then start to say, all right, we actually have a whole program built around this. And we believe in 3 months with this intensive lifestyle management program that you will have some sticky habits that will avoid you not only not having that heart attack, but you're going to lose weight. You're going to feel 10 years younger. You're going to actually enjoy your life more, and you're going to avoid getting onto 6 to 10 medications. That's your trajectory right now if you don't do something about your health. And so that kind of mature conversation and then a relationship that develops with all these different care members that form that peer group of support leads to people leaving in 3 months with 30 to 40 pound weight loss, with a huge drop in their cardiovascular risk, with new belief. And frankly, I think the belief that they can do something about their health is maybe the most important thing we're doing. People leave going, oh my goodness, I'm no longer a victim of genetics or whatever I thought was going to kill me. I am proactively doing something about this, and I feel so much better. That alone is a massive motivator of getting people through that. Oh, I can't exercise. Oh, I like exercise. Oh, I feel good. That's going to be what I think keeps people on the sticky trajectory of 20 years from now. They're not on hypertensive drugs, cholesterol drugs, having the first MIs, going on to dialysis and so forth. And we know that's true. Just with diabetes prevention alone, 90% of Americans that are pre-diabetic, this is a crazy statistic, and one of the ones that bothers me the most, 90% don't know it. 90% of people that are about to be diabetic have no clue. And it's a simple screening questionnaire that leads to a blood test that leads to information. 25% of diabetics in America don't know they have diabetes right now. That's a crazy number, because they're going on to dialysis in the next couple of years because they don't know it, and losing feet and losing vision and so forth. So we're really all about pre-screening populations that we take care of to get them aware. And then I really motivate my care team to say, it's not okay just to make people aware. Now our job, now that we're in this equation with them, is to get them into primary care that gets them into these programs that get them to develop lifestyle changes that make a massive difference. Crazy statistic. If you just get a pre-diabetic, into a diabetes prevention program, which is a lifestyle program, you delay onset of diabetes by 11 years.
Wow.
One intervention at any time, 11-year delay, massive savings, but also just think about all the burden on that patient that's avoided. So we're all about prevention by screening and getting people into an effective program and supporting them. And iterations of change is the key in this model. Is you can't just force a diet. Yet we'll often have 4, 5, 6 different versions of a diet by the end of the 3 months. And this is my story. I was 30 pounds overweight. I was an old jock athlete, they call it in America, just, thought I would never die. And then I realized, dang, I can't keep up with my kids. What's going on? And I took this job at Medici and I said, this is not okay. I am the part of the problem. I have said that I'm going to wait until I get sick to address my health. And so I found after many iterations that, hey, I like smoothies. So I am now the smoothie doctor at Medici. I make smoothies every day for my whole care team. And I lost 30 pounds by just finding something I liked to eat, decreasing some of that, I would say, guilt or boredom eating, and starting to exercise. And now I just realized, man, I was the guy that didn't believe I would ever change. And it wasn't that hard. I just needed a little support to do it. And so I'm on fire for this. Everyone we hire has to believe that this is what comes first is lifestyle change. We're not rushing the medications at our program, and it works. And our average employee here loses weight and feels better and integrates into all of our programs as well.